All right, so today in this lecture we will actually talk about blood flow, blood pressure. We did start this last time, and then resistance, blood pressure, factors that affects blood pressure, hypertension, consequences, all of that, right? So quickly a recap: what is blood flow? Blood flow means the blood that is flowing simply through your vessels, through your organs. It is measured in ml in minute, right? Equivalent to cardiac output. What is blood pressure? Blood pressure is the force that the blood is exerting on the blood vessels in per unit area, expressed in millimeter Hg, right? What is resistance? Resistance is when a blood is flowing through a vessel. What kind of like it is flowing, but what kind of opposition it is facing while it is going through the vessel. So that is the peripheral resistance or resistance. Simply, it's the amount of friction that the blood encounters in the blood vessels. Three things that can impact this: blood viscosity. Viscosity means thickness, blood vessel length, and then blood vessel diameter. So, what is viscosity? Thickness, stickiness of the blood due to the presence of the formed elements, which is the cells basically, and the plasma proteins. More the viscosity, naturally more the thickness, more it will have, the blood will have a hard time to flow through, right? So if we have high blood viscosity, that means resistance of that type of blood will be more. Okay, so that will be more. Suppose you have a milkshake and like just liquid milk, so milkshake will have hard time to you'll have a hard time to pull the milkshake through a straw compared to just normal milk, right? So then, because liquid milk will easily flow and the milkshake will have hard time because that is a more viscous fluid. Now, longer the vessel, the greater the resistance it encountered, simply because it is traveling long distance. Blood vessel diameter, this has the greatest influence. Like, let's go back to this. For example, you're trying to pull up a viscous fluid, suppose it's the blood, going through a straw that is like that has more diameter compared to a really thin one. So naturally, you're going to have more problem in this one. Even if the blood is thin, suppose you are pulling up a thin blood, like a liquid blood, still this, if the diameter is small, then it is going to have more resistance, right? Because the space you are getting, that is small. But if we have a bigger diameter, blood will have easier time to flow because there's more space available simply. So this actually frequently alters the peripheral resistance. Okay, blood vessels, and although viscosity typically in a human being, like in one person, is typically constant, obviously blood vessel lengths don't change as such. But what actually influences then that, like the blood flow, that is the diameter of the vessels. Okay, the fluid that is more close to the walls have like flows more slowly. Why? Because at the, like suppose this is the wall and this is the wall, that is where it is direct, the blood is directly going to encounter with the wall, so that is, it is encountering with something solid, so that is where the friction will be higher. Okay, so the friction will be higher in near the walls. But in the middle area, there is no wall, so therefore it will easily flow through the middle of the tube, and that is this kind of free flow, we call it as a laminar flow. Okay, so if radius increases, the resistance decreases, and vice versa. So if radius is double, resistance drop to 1/16 as such, as much. For example, smaller diameters arterioles are also gives the maximum amount of peripheral resistance, right? Because they are the smallest vessels. So blood flow essentially therefore is proportion to the pressure gradient and then the resistance. So, and flow and resistance obviously is not directly related to each other, they are indirectly related to each other. More the resistance, less the flow, or vice versa, right? More the resistance, less is the flow. But flow is directly related to pressure. Why? More we have flow, blood flow, it will be more we will have pressure. So therefore, if we put this together, then we will see flow is directly related to the pressure but inversely related to resistance, right? So R is more important, therefore influencing the local blood flow, because it can be changed by altering the blood vessel diameter. All right, so remember this formula: flow is equally it is directly related to pressure but indirectly related to resistance. So, concept check number 4, predict the change in peripheral resistance at blood vessel diameter um, increases. So, if diameter is increasing, naturally the change, the peripheral resistance will. So, if the diameter is increasing, the diameter getting bigger, so naturally the peripheral resistance will decrease, right? So, in this case, it will decrease, and vice versa, the opposite case. Next one is systemic blood pressure. So as the blood flows, so naturally it also creates a pressure, right? So pumping action actually generates a blood flow, and pressure results when the flow is really opposed by some form of resistance. So that will create, that's an opposition. So something is stopping the flow. So that's going to create more and more type of pressure. So systemic pressure is always highest in the aorta, because again we discussed this before. Aorta has the pressure of supplying, making sure that the every organ is getting the blood. So aorta, for example, the biggest aorta, that is the highest amount of blood pressure. From aorta to the smaller arteries, the blood pressure will decrease. It will be much lesser in the arterioles, lesser in the capillaries, and the veins have the lowest blood pressure, and the most lowest amount of blood pressure we will see is in the vena cava, which is the largest vein. Why? Because vena cava is simply passively recollecting the blood from all the organs. So naturally, this is a direct relationship. From aorta to vena cava, we will see a steep drop in blood pressure. All right. Now, if we take now the highest amount of blood pressure that we measure, we also discussed this, that is called the systolic pressure that we measure during the heart systole, and the lowest one that we measure is called as a diastolic pressure. Okay, the mean of that, of these two figures, we call that as a mean pressure, the average of the systolic and the diastolic. So let's first talk about arterial blood pressure. Obviously, artery has the highest amount of blood pressure, and this is influenced by two factors: the elasticity of the artery, okay, and the blood volume that it is that is flowing through. And blood pressure near heart is always pulsatile, is controlled by the pulse. Now there are two types of pressure that we can see: pressure exerted in the aorta during the ventricular contraction. We learned about this is about 120, and the diastolic is the lowest amount of aortic pressure when the heart is at rest, which is around 80 mm Hg. And if I'm taking the pulse pressure, then we have to take the difference between that. So 120 minus 80 will be the pulse pressure under normal circumstances, right? Which will be around 40 mm per Hg. 40 mm Hg. Now, throbbing arteries, due to difference in pulse pressure, we can feel that under the skin. And where can we feel it? I'll come back to this. So these are the different locations that you can actually, pressure points where the arteries are really close to your body, and you can actually measure the pulse is easily can be measured in this area. For example, often you will see physicians or like doctors, nurses, they check your blood, like the pulse pressure your inner radial artery around your wrist, sometimes around here brachial artery, and these are the other pressure points. This is most routinely checked. All right, and so these are all the pressure points that are close to the body surface. So these are, we use this for clinical monitoring when we are measuring arterial blood pressure. Now, what about mean blood pressure? So this is the pressure that propels to blood tissues. So we discussed what is mean blood pressure. It's the average between systolic diastolic. How can we measure it, or how can we calculate it? We will calculate with, if for calculating our mean arterial pressure, we need to know what is the, first of all, the pulse pressure. And how do we know that? We just discussed is the difference between the systolic and the diastolic pressure. Now, this is mean arterial pressure, hence we are only considering systolic. We will take account the systolic diastolic pressure, right? So because pulse pressure is because systolic and diastolic pressure, we measure that, or it is observed in the aorta, in the arteries, in the aorta specifically. So Therefore, when we are calculating mean arterial pressure, we take account the blood pressure, systolic diastolic pressure again. First, we calculate the pulse pressure, the difference between systolic diastolic. Now, what is then MAP, mean arterial pressure? Is first you take the pulse pressure, then you multiply that with one third, like take one third of the blood pressure and add that to the diastolic pressure. So in this case, you have the pulse pressure calculated in 40 as 40. One third of that is approximately 13, and you add that to the diastolic pressure, which is 80. Then we get our mean arterial pressure. Okay, so here we are again. The main two things we are considering is systolic diastolic pressure, but both of these will decline as we go away from the heart, because that is the heart's pressure, the blood pressure, pumping pressure is maximum obviously close to heart. So we saw this clinical monitoring. Now, how do we measure blood pressure? We use a special instrument called sphygmomanometer, and you will actually use this in lab to see this. You wrap it around your arm, like around this area, brachial artery area. Brachial artery actually gives us the best pressure measurement of systemic the blood pressure or the systolic diastolic pressure, because see, this is where a heart is, right? So basically this is where the heart is, and brachial artery is closest in with respect to the heart, so we measure it here. So you will see that you will wrap around that sphygmomanometer around your arm, which arm doesn't matter, but you will do that, and then increase the pressure until it exceeds the systolic pressure. You will measure that with a measurement. There will be a way you can measure it, like there will be a meter where you can see that the pressure is going up into systolic pressure, and then you will slowly release it, and then you hear the sounds of Korkov. What is this thing? What is this Korkov sound? This is the sound that typically medical professionals listen to when they're like trying to take blood pressure in a person, and we do that by a non-invasive method. Like you are non-invasive means you are not really getting into the body but measuring it from outside, so you only hearing the sound. That's how you know the pressure of that person, blood pressure of that person. So typically, so firstly you measure the systolic pressure around 120. This is when you first pressure, when the sound first occur, as the blood starts to sprout through the artery, like releasing through the artery, first sound. And then diastolic pressure, we know it's normally around 80 or less. So when the sound disappear, because artery is no longer constricted and blood flows freely around this time. So this will be a more stronger sound, the systolic one, and this will be a much more could be difficult to hear this one. So I'm not going to get into a whole lot of details into this, because this is more like, as you can understand, this is more of a practical activity, and I will do this in lab. Capillary blood pressure. So arterial blood pressure is the most important one, but capillary blood pressure, like if we are going in this direction, so firstly highest blood pressure is in the arteries. Now we are around here, and then the lowest will be in the veins. So the capillary blood pressure is around 35 mm. Beginning of capillary bed, which is around 17 at the end of the bed. And we typically want capillary pressure to be low, because the capillaries are thin walled and they can rupture if the blood pressure is too high, and they are very permeable. Venous blood pressure. So venous blood pressure is the lowest, right? It's only about 15 mm per Hg, and the lowest pressure we see in the vena cavas, because they passively are connecting the carbon dioxide rich blood from the different organs. So vein is cut, if your vein is cut really low, the blood will come out smoothly, but if your artery is cut, because artery contains the blood in a very high pressure system, it will sprout out, like it will come out like a fountain type of like that. But in this case, it will be slowly, it will come out for veins. What are the factors that aids veins return? Because vein has such a low system, like low blood pressure, so how does vein even make sure that a blood is actually flowing through the vein? Firstly, muscular pump. This should be 2 and this should be 3. So muscular pump is basically contraction of the skull, because veins or any any vessels are within the muscles, right? So the muscle itself sort of contracts to milking the blood through the valve, through the veins. And veins also have valves. Once the blood passes, then the valves actually close, preventing backflow. Second is respiratory pump pressure changes during breathing, so that blood can move towards the heart. And then this will when you breathe actually, then it will squeeze the vein, so that is also a pressure sort of pump that you're putting towards the vein to flow the blood. Sympathetic vasoconstriction. Under sympathetic control, smooth muscles contract, pushing the blood back to the heart. But okay, so two main first thing is muscular pump and respiratory pump. When you are like doing the respiration, you are doing a squeezing activity, like you're breathing in or breathing out, then you're squeezing the abdominal veins or thoracic veins and making sure that the blood is flowing through these veins actually. Regulation of blood pressure. Blood pressure is requires like in order to maintain our ideal blood pressure, which is 120/80, we need to like couple of things work together. Firstly, heart, blood vessels, and then the kidneys. It is also supervised by brain though, obviously, because everything is supervised brain. Now, three main factors that regulates this: cardiac output, peripheral resistance, and blood volume, right? So let's discuss this. Firstly, suppose again, you remember flow is equals to pressure, but it is inversely related to the resistance. Okay, now flow and cardiac output is all actually the same thing. More you have blood flow, more you will have cardiac output. Therefore, if you simply replace flow by cardiac output, it's the same thing. Cardiac output is also directly related to pressure, but inversely related to resistance. More the resistance, less it will have hard time for the blood to flow. Therefore, your cardiac output also will be slow. If you just simply rearrange this thing, then cardiac, so CO means del P, which is the change in pressure, by R. So del P means, right, so del P will means CO, you simply like multiply these two together, so it will simply mean CO times R. So pressure is actually a combined factor of cardiac output and resistance. So therefore, since this is change in pressure, therefore mean arterial pressure is also directly proportional to cardiac output and resistance, right? So one variable changes, everything else will change. You change pressure, means these are changing. You change resistance, everything will change. So therefore, again, keep this in mind that del P is equal to cardiac output and times R, right? So we know that here. And we have learned this previously. The cardiac output is a product of stroke volume and heart rate. So you simply, if you replace this cardiac output with this, so then we get like MAP is a factor of, therefore is a combination of stroke volume times heart rate times resistance, right? So because we have known this from the previous chapter, if you don't remember, please go back and check this. And we now discovered this. So MAP, or the pressure, is directly related to cardiac output and resistance. You simply replace cardiac output with stroke volume and heart rate, then we come to this formula. Therefore, mean arterial pressure is a product of stroke volume, heart rate, resistance. Means if you have any change in stroke volume, heart rate, or resistance, any one of these factor changes, everything else will change. For example, suppose you have a higher stroke volume, higher heart rate, that is going to directly obviously impact the cardiac output, that is going to directly impact the mean arterial pressure. If your blood vessel diameter is decreasing, blood viscosity is high, blood length is high, that is directly going to impact the peripheral resistance. How? Because if you have less diameter and more viscous blood, more thick blood, naturally the resistance is going to increase. If resistance increases, directly mean arterial pressure increases. Okay, so if in this way mean arterial pressure increasing, means your cardiac output is also increasing, stroke volume is also increasing. If you put lot of pressure into the vessels, naturally the output has to increase in order to maintain your system. The stroke volume, heart rate has to increase, it has to go higher in order to maintain your system, right? So if this is impacting, then the whole system goes up. So there are mechanism that kind of impacts the mean arterial blood pressure, right? So one of the main important thing is the reflex arc that actually influences blood pressure. Okay. And this is the baroreceptor reflex arc. What is baroreceptor? Baroreceptors are small little tiny receptors that is located on the walls of blood vessels, and particularly we see these on aorta or the arteries. Okay. So what happens? Suppose your blood pressure is in normal range, this whole thing will be fine. But if your blood pressure changes, the baroreceptor is going to, because it detects blood pressure change, it's going to detect that. And that is going to be picked up, impulses from the baroreceptor is going to be picked up by brain, and as soon as that does that, it will stimulate the cardio inhibitory center, because your blood pressure is high, so your cardiac activity needs to go down. Immediately the sympathetic activity will go down, making sure your heart rate, cardiac output, everything is going down, so that blood pressure is restored. And at the same time, this will also rate of vasomotor impulses will go down. Suppose your blood pressure is low, same thing will happen. Baroreceptor is going to detect that, and now the brain will also be brain will also obviously detect that from the receptor, but instead of the inhibitory center, now the cardio acceleratory center will be activated, because your blood pressure is low. So your sympathetic activity will go up, your heart rate, cardiac output, everything will go up, so that the homeostasis balance is maintained. So important thing is, first the stimulus, then baroreceptor, then if your blood pressure is high, then inhibitory center will increase, will actually start working, so that your cardiac output is anything related to sympathetic nervous system activity will decrease, so heart rate, cardiac output will decrease. And exactly this opposite thing will happen if you have low blood pressure. Other than that, couple of other things that can also impact, for example, if you have high amount of carbon dioxide, or pH is dropped, like your blood is too much acidic, then that also is a kind of will impact the blood pressure slash blood flow. Higher blood centers, reflexes that generate BP are found in medulla, so they will be impacted. Hypothalamus, cerebral cortex can also modify arterial pressure with the help of medulla. Hypothalamus increases blood pressure when we are stressed. Hypothalamus mediates redistribution of blood when you're exercising, when you're running, and then that also changes our body temperature. So these are a couple of factors that can also, for short time, can impact our blood flow slash blood pressure. Other than that, there are a couple of hormones like adrenal medulla hormones, epinephrine, norepinephrine from adrenal gland, can increase cardiac output also, sympathetic activity. Angiotensin, ADH can do vasoconstriction, that will increase blood activity, blood pressure. ANP, this is a hormone that is secreted from the heart, it also decreases blood pressure when it is like basically required. So you need to know the name of these hormones, for example, epinephrine, norepinephrine, angiotensin, ADH, ANP. These are the hormones that can specifically impact the blood pressure. All right, now what is the long term control? This is done by renal regulation. Two methods, direct and indirect. So what is the direct and indirect method? Direct method, suppose you have low blood pressure, plain and simple, then your filtration by kidneys will go down, because you need blood now in your body, so therefore kidney will reduce its filtration, so urine output will go down. As a result, you will restore your blood volume, so the mean arterial pressure will again go back to normal. So this is a direct mechanism. What's the indirect mechanism? Here they will take help, the kidney will still do it, but it will going to take help from different hormones. Your blood pressure is low, the baroreceptors are inhibited, so sympathetic activity, you need to be active now, so sympathetic activities will go up. Renin will start releasing some hormones. I mean, kidney will start first of all releasing a hormone called renin. Renin will do some lots of intermediate activity, and finally it will start creating another set of hormone called as angiotensin. So first renin, with some intermediate activity, then it will start creating angiotensin, specifically angiotensin 2. Now, what will this do? Firstly, will impact the adrenal cortex. Then it will start creating aldosterone. So your sodium absorption will increase. It will directly impact the posterior pituitary so that ADH is more released. That will create more water reabsorption. Your thirst, your brain center for thirst will actually be stimulated, so you actually start drinking more water, and vasoconstriction will also increase, right? So all these factors will actually impact your blood volume, then the mean arterial pressure will increase. So this is not so much so direct activity. So your sympathetic, this is done with the help of sympathetic nervous system activity. So when sympathetic nervous system is active, in this case, if you have low blood pressure, then renin and angiotensin will start secreting. Four target areas that these angiotensin will target. Firstly, adrenal cortex, so that you can have more aldosterone. Remember, the function of aldosterone is to create more sodium absorption. ADH will start creating, ADH is involved in water reabsorption. So aldosterone, ADH, the thirst center of your body in hypothalamus will actually be activated so that you drink more water. And then finally, vasoconstriction. So I'm not going to ask you the entire flow mechanism, but you need to know what is this process, why sympathetic nervous system is active here, what are the hormones, renin, angiotensin, and what are the target areas that indirect renal mechanism actually can target. Okay, the goal for both process is to increase your blood volume so that the blood pressure is restored. This is the basically the summary of what we just discussed. What are the all factors that can actually increase your MAP? All right, so quick check. If you have a blood pressure of 110 by 80, what is your pulse pressure? It's simply the difference between the two, and then you calculate the MAP. We discussed this in detail, so go back in a couple of slides and do that. How MAP and pulse pressure changes with increasing distance from heart? Simply it will decline, right? More the you will go away from your heart, your blood pressure is going to decline always. What is the homeostatic imbalance in terms of blood pressure? Basically, blood pressure can create hypertension or hypotension. Okay, there is no specific reason for that, but this can be influenced by age, sex, weight, race, mood. What are you doing? Like, are you working? Are you exercising? That also can impact BP. For example, primary hypertension. So this means you have elevated arterial pressure of 140 by 90. We can have a pre-hypertension range, means it's there, but it's not yet in this completely in hypertension. Sometimes you're hypertense, but not all the time. But if you're completely a person is in hypertension, then this condition will be a sustaining condition. No as such particular reason, but the reason can be heredity, diet, obesity, age, even diabetes, stress, all of that. So basically, self-care is the main way to deal with it. Restrict salt so that your aldosterone is not like absorbing too much of sodium. Exercise, lose weight, and maybe some drugs also. Secondary hypertension is very uncommon thing due to identifying disorders in kidney, because your whole mechanism, the whole balance mechanism we just discussed, that can actually get disrupted by this. But this is a very uncommon thing. Hypotension means you have really low blood pressure, 90 to 60. This is not a huge concern because it's okay to have low blood pressure, but as long as you're not, it's like not dropping too low so that you will feeling dizzy. If that happens, then that could be a constant. For example, if you have orthostatic hypotension, means you have low blood pressure temporarily, so you're suddenly like standing from a sitting position or a lying down position, you suddenly can feel dizzy. Okay, chronic hypotension means it's like lasting for a long time, means probably you have poor diet or something like that. Circulatory shock, when the blood vessels inadequately fill and cannot circulate normally. Okay, so that cannot meet the tissue needs rather, so that's called circulatory shock. All right, so we'll stop here, and the next time we will actually talk about how blood flow happens specifically in certain specific organs. All right.